I would like to present the transition of medical care for desmoids through a questionnaire survey of specialized facilities in Japan. This is my COI. This slide shows the process of establishment of algorithm and clinical guideline for desmoids in Japan. In 2014, Ministry of Health, Labor and Welfare in Japan approved the activities for establishment of desmoid clinical practice guideline. The research group by orthopedic oncologists formulated treatment algorithm for desmoid in 2017, completed the clinical guideline in 2019. As you know, at the same time, global consensus paper by Europe, North America, Japan was published in 2020. The Ministry of Health, Labor and Welfare Research Group has carried out educational activities on appropriate medical treatment for desmoid in the process of developing algorithms and clinical practice guidelines. Activities included lectures and presentations at academic conferences, open lecture to citizens, disseminate the information through homepage of our organization. To confirm whether appropriate medical guidelines for desmoid are widespread or not. Questionnaire surveys of medical professionals involved in clinical practice for desmoid and surveys of actual medical care are required. So, the purpose of this study is to clarify the transition of medical care for extra-abdominal desmoid in Japan by conducting a longitudinal questionnaire survey on desmoid medical care for participating facilities of the Japanese Musculoskeletal Oncology Group, JMOG. JMOG is a multi-center collaborative research organization for bone and soft tissue sarcoma. More than 80 facilities are participating now. The first survey was conducted in 2015, and second survey was conducted in 2018. Actual content of the questionnaire is in this slide. Biopsy method, pathological diagnosis, initial treatment modality, treatment modality in case of size-up, treatment modality in resectable and unresectable case. Results of the survey. First, needle biopsy. Was performed in many facilities. In case of difficulty in diagnosis, open biopsy was subsequently performed. For pathological diagnosis, many facilities utilized immunohistochemistry for beta-catenin and MIB1 index. Interestingly, in both 2015 and 2018, only few facilities used ctNNB1 mutation analysis for diagnosis. Regarding initial treatment modality, the number of facilities selecting wide resection was decreased, while the number of facilities selecting active surveillance has increased. Among medical treatment, the first drug to choose is COX-2 inhibitor and or tranilast, which seems to be Japan-specific phenomenon. Difficult to resect cases, frequency to select active surveillance increased. As medical treatment for difficult to resect cases, COX-2 inhibitor and tranilast were also selected. In difficult to control cases, uncontrollable cases, doxorubicin-based chemotherapy, low-dose methotrexate and vinblastine, pazopanib, radiotherapy were mainly selected. In Japan, sorafenib could not be used easily for patients with desmoid. To summarize these results, ctNNB1 mutational analysis is generally not performed in Japan. The number of facilities that choose surgical treatment has decreased. Active surveillance is being main treatment modality. COX-2 inhibitors and tranilast are used in the absence of evidence in Japan. Several facilities are considering the use of pazopanib, which may reflect global guidelines for desmoid. It is necessary to continue to disseminate the contents of the guideline, not only to orthopedic oncologists, but also to physicians of other departments, such as general surgery, thoracic surgery, plastic surgery, and otolaryngology, as well as to patients and their families. Thank you for your attention.